My name's Christina. I am the owner of Contour by Christina. I provide services in regenerative aesthetics such as Botox and fillers, as well as PRP injections and hair restoration using mostly plant-based exosomes as like the primary mode of treatment.
And I'm Dr. Maggie Grothy, general dentist and owner of Root Dental. And we take a kind of functional medicine approach to dentistry, very comprehensive, looking for root cause and not just treating symptoms, but treating the whole body through the mouth. You saw a comment once that like someone said like, do you do lip fillers or do you get veneers? Which is kind of funny because those are like
Two
literally
completely separate things.
completely separate things.
Yes.
Completely separate things.
Yeah.
But I feel like it also raises a good point that like when looking at getting cosmetic dentistry or when looking at getting like aesthetic treatment done, it's important to talk to both your,
Injector and dentist.
yes,
Yeah.
absolutely.
Yeah. The two
Right.
can definitely go hand in hand, especially if you're concerned about fixing your smile in general. Maybe you need a little bit of both. We
Yep.
can consider veneers and lip filler to
Yeah.
achieve the goals that you're looking for.
Absolutely. And if you do want to do lip fillers or veneers, like it's good to coordinate between the two because if you get veneers and then you decide to get lip filler and your lip migrates up, then your smile end is different. Your gum amount of gums that are showing are different. So like check with both before you do one or the other if you're planning on doing both.
Yep. So that's why it's good to consider having like a collaborative care plan between your dentist and your aesthetic injector, just so we can make sure that we can get the best outcome possible for you.
Yeah. You also do Botox, right? So like tell me a little bit about that because I know one other thing that's really common between what we're doing is looking at TMJ pain and looking at clenching and grinding. And I don't do Botox. That's in your wheelhouse. So tell me a little bit about that and like what you see.
So it is really great for the jaw clenching, getting Botox in your masseters. A lot of people have reported that they've had an improvement as far as their clenching goes, as well as from an aesthetic standpoint, a gummy smile. There was a time when I was a patient at the dentist and I kept complaining that one side of my gums would show more when I would smile. And this was before I ever even got Botox myself. The dentist suggested it to me to help make the smile more symmetrical. So things like that. The Botox is really great for all sorts of aesthetic and medical purposes as well.
Absolutely. And one thing that I recommend, and this goes back to, having like good coordination of care between your providers, is that with Botox, so the masseter, it's really great to have a dentist evaluate you for sleep disorders first, because if you, get an injection with Botox and there's sleep apnea present, it, yes, can help diminish the symptoms of clenching and grinding, but it can also exacerbate sleep problems. So I would always recommend that someone gets a sleep test done if there are risk factors present for that before doing that. And then if everything's all clear, absolutely keep, proceed with that treatment. But that's, the other thing that we, look for as collaborative providers.
Absolutely.
So tell me a little bit too about, the other aesthetic treatments that you do, because I was so impressed with how many different services you provide, and they're so like natural and they work with the body, and I would love for you to explain some of that.
Yeah, so one of the biggest things that I offer is the PRP filler. So the awesome thing about that is we draw your blood and then spin it down, take the protein out of it, essentially the plasma. I put it through a process of heating and cooling, and it turns into almost like a gel-like substance that could be semi-comparable to the consistency of filler. It's a little less. And then we re-inject that back in anywhere in the face, but predominantly a lot of clients like under the eyes. We can do around the mouth and perioral area, in the chin, wherever, even the marionette line. So that's another way too that it can address the smile and essentially help stimulate collagen in the face.
I'm curious, do you always have to inject collagen in order to get the benefits of it, or do those like topical creams even work?
So I tend to stay away from topical collagen creams because the molecule is generally too big to penetrate through the skin.
Oh, so they don't even work.
Right. So I mean, it does help with like restoring and maintaining a degree of like moisture.
Sure.
But your skin cannot
What about like the peptides, like the powder, like that you put in your coffee? Does that even work?
Yeah, so I mean, I'm a big fan of the Vital Proteins collagen peptides.
Okay.
That has the bovine in it,
Mhm.
and I always recommend that to all my patients.
Okay.
But I do always tell my patients, especially any of the ones that get the PRP filler, if
Mhm.
we're really like working from a regenerative standpoint, I recommend that they do the Vital Proteins collagen,
Mhm.
and then also if of course they're healthy enough to be having electrolyte supplements, I also recommend doing electrolytes as well.
So what kind of electrolytes? Is this like Element or Noon or
Yeah,
like?
I'm a
Okay.
big fan of the Element.
You like Element?
Oh
Okay.
yeah,
Those are
that's
so
my
popular.
favorite.
Yeah, for sure.
It's the sugar content in some of these is
Oh, it's
absolutely
insane.
Yeah,
Yeah.
11 grams in some of them.
It,
So
like liquid IV is so it's like
11
half
grams.
sugar.
Yeah,
Yeah.
it's insane, and it's
So
like
then you're bombing your teeth out instead of
yep.
Yeah.
It's so
Mhm.
bad. I also tell clients to, maybe if they don't want to do the Vital Proteins collagen peptides, they can also have bone broth.
Oh,
Yeah,
okay.
so bone broth has got a lot of collagen in it as well.
Okay.
Yeah.
Because I've always thought of like the collagen for being for like nails and joints, but it's good
Mhm.
for your skin too.
Yep, because
Okay.
the structure in your skin is collagen.
Yeah.
Basically losing about 1 to 1.5% of collagen per year,
Mhm.
and by age 30, we've already lost 10%. So it's important to keep up.
Yes.
I know.
I kind of wish I didn't know that.
I know. Once you know that and it's in your head, you're just like,
dang it.
well, now I gotta invest in
Yeah.
taking collagen every day. And
Yeah.
But it is important
Mhm.
if you want to just have some degree of wrinkle prevention and skin collapse.
So tell me about the skin collapse because I know that's important with like around the lips for having like a youthful smile.
Yeah.
It's like collagen and skin collapse. Tell me about that.
So as I said, we are losing collagen, and so a lot of women will start to develop like we call them smokers lines around the mouth, and basically like your lip starts to downward turn,
Like migrate kind of.
It's not like it's migrating per se. It's more, I guess,
Like it just gets like longer.
Yeah, elongates.
Okay. Yeah.
Essentially. So providing internal structure, of course, collagen, and then we can also do the PRP filler, which is going to give a little bit of structure as well as stimulate collagen. So the idea with the PRP filler is that you are bringing more blood flow to that area, and your blood contains all the nutrients, right? So you've got your oxygen and all the things you need. So if it's sitting in that area, it's going to constantly be working to bring all those nutrients to ideally build more collagen for you. So, and if you're just supplementing collagen as well, it's like it's only helping.
Yeah. So don't waste your money on the creams, is what you're saying.
I don't.
Off the record.
Is it my favorite thing? No. Is it my first choice? No.
Yeah.
But
probably won't hurt you, but not
won't hurt you.
Yeah, for sure. Myth or fact? Grinding only affects your teeth.
I want to go with myth.
You are correct. Grinding does not only affect your teeth. Yes, it does wear down on your teeth, but it can also cause TMJ or joint problems. It can cause muscle enlargement and jaw tension.
I guess that makes sense. I would also have to say that if you're causing muscle enlargement, then that's going to widen your lower face. So then you're going to have to come see me.
Absolutely. The other thing too is that we want to figure out like why we're clenching and grinding, because yes, it can affect your teeth, but you also want to figure out like what it's a symptom of something. So what is it a symptom of? Is it an airway issue? Is it a sleep issue? Is it a nervous system issue? So there's a lot going on that yes, the downstream effect of clenching and grinding is affecting your teeth, your joints, your muscles, but also like why are you grinding?
Right. Yeah. Yep. Get to the root cause of everything.
Heck yeah.